would start wound packing by coming into the room, knock knock knock. Hello, Mr. Matthias. I perform hand hygiene. I'm going to go ahead and do some wound care and wound packing treatment on your wound today. Can I see your, could you say your name and date of birth, please? All right. Name J. Matthias, great. Birthday? 7/20/1950, good. Do you have any allergies, particularly to antiseptics? You use penicillin? Okay, that's what I have listed too. Okay, good. So I'm going to go ahead and do your wound dressing today, if that's all right with you. If you have any issues, let me know. I'll go ahead and get started here. So I'm going to go ahead and don my gloves. I will disinfect my bedside table according to the manufacturer's recommended amount of time. For this particular wipe, it's 3 minutes, but for the sake of the video, I'm going to sanitize for 30 seconds really well and just demonstrate technique. So I'm going to make sure to get the whole surface. Get the edges real good, because we will need that for our sterile field. Normally I'd make sure to maintain moisture on this for 3 minutes, but 30 seconds will demonstrate as long as I verbalize. At this point I'm going to doff my gloves because I've got antiseptic on them. And perform hand hygiene again. And then I'm going to don a new pair of gloves as I get ready to assess the drainage wound, or the wound, just in general. I'm going to don a new pair of gloves. And I'm going to get this bed rail down, because it'll help me get closer to the patient. I would raise it up to waist level if I could. And this bed right now is having problems going up. It can adjust, but we can't go up. But I would raise it to waist level to reduce, to have proper body mechanics to avoid back problems. And once I finally get my gloves on, I will go ahead and get a couple things ready. I'm going to get my biohazard bag here. I'm going to turn it inside out a bit. And when I expose the area for the patient, I'm going to probably place it right here, just to have it by so I can toss stuff in. And I'll dress the wound in a minute. I'm going to get the pad and go ahead and get that ready too. I'm going to go ahead and unfurl a pad here and tuck it alongside the patient in case we have any anything bleeds or any extra stuff that comes out. Alright, so now that I have the patient up and exposed to the sewage, I'm going to assess the exterior bleeding. I don't see any drainage or bleeding or any extra moisture on the outside, so it looks pretty dry to me. So I'm going to go ahead and remove this slightly. Let me know if you have any pain, Mr. Matthias. I'm going to push down a little bit to help the tape so I don't hurt the patient. Okay. I'm going to assess the underside for the same thing, looking for any dryness or any moisture. In this case, it's pretty dry. It's a pretty dry wound. So I could dispose of this in the trash, but I'm going to dispose of it in the biohazard since it's right here. And then at this point, I'm going to assess one gauze layer at a time. I'm going to pull one layer, look for any moisture, any drainage. This looks dry. I'm going to pull another one. Right, that looks dry too. I'm going to pull the last one. And I don't see any moisture on there, so it looks dry. Okay, since it's all dry, I'm going to go ahead and move on to the tweezers and assess the strip. If there were drainage, it would be a good idea to change gloves so as to not introduce anything back in. So I'm going to get our sterile tweezers that we have. I'm going to pull it from the outside, making sure to only touch so much to keep it sterile. I'm going to remove the strip at this point. Mr. Mattias, let me know if you experience any pain. Okay, I'm going to remove this drip. I'm going to assess it for any drainage, any color, any abnormalities with the color of it or the moisture. And it looks pretty dry, so I'll put it in the biohazard bag. And this would go in the sharps container. For our purposes, I'm going to set it over here, but I would dispose it in the sharps since we will reuse it for class purposes. I'm going to assess the drain or the wound now that it's open. I'm going to use the Rita technique. So I'm going to first off look at redness. I don't see any redness with the wound. Edema. I don't see any swelling or fluid around it. It's not protruding. Ecchymosis is bruising around it, and I don't see any discoloration or bruising. And then drainage. Drainage, you could look for several things. It could be serous fluid, it could be sanguine or sanguinous, it could be sanguinous fluid, or it could be purulent. This could vary between clear fluids, blood, or thicker fluids, but I'm not seeing any sort of drainage from it coming out. And the last thing of Rita is approximation. Normally with wounds, approximation wounds would be together when healing. In this case, with this wound packing, the wound is not approximated, it's separated. So the wound is not approximated with the Rita. All right, so Mr. Mattias, I will go ahead and start prepping to get your wound packed and clean. So I will doff my gloves here. Perform hand hygiene again. Squirt. I'm going to start assembling my material. So I'm going to go ahead and get my package, unopened package. I'm going to go ahead and get my saline and my strips and bring them over. And at this point, I am good to open my package. And remove the contents. Put that there. This will go in the trash. I'm going to open up my container, making sure to not touch the sterile field. Then I've got my gloves, so I'm going to set these aside. These are medium, so bear with me. They are quite small for what I'm used to. I will don them the best I can. I'm going to go ahead and take the caps off of these, because I won't be able to access these when my hands are sterile. And I'm going to go and overturn the container. I'm going to grab a tip like this, and making sure, I'm going to grab it from this side, making sure I don't touch that. Overturn it, okay? And I'm going to turn this way, making sure I'm trying to avoid touching my sterile field. I will remove that. I will use the other container for this is wedged in there, so I will use that for the other one for the saline, since I don't want to. I'm going to assess my label to make sure I'm pouring from the same side. My label is right here, so I'm going to pour this direction. So, trash can's a little full. I will pour this direction. I'm going to pour it up so you can see this direction. Just a little bit. There's the label again. Not to reach over the sterile field. I will pour in. There's no good direction here with that wedge. I don't want to reach over the sterile field, and I'm acknowledging that. But I will pour into this container. Try to minimize that side of the sterile field since my equipment's over there. And I'll put the cap back on, make sure nothing bad happens. I don't want an accident. At this point, I will don my sterile gloves, so I will unfurl, cup into me, unfurl, slide my fingers underneath. This is going to touch the sterile field, but I will acknowledge to not put stuff in that area. I'm going to pinch. Again, bear with me, these are quite small. I guess I should have tried to get a bigger glove size. Mediums are quite tough. I will try to demonstrate technique, but keeping the inside here, pinch while I pull. And I'm gonna have to make do. Okay, it's a little tight, but I'll make do. I'm gonna slide my fingers underneath. Keep my thumbs apart, keep in the sterile field. Trying to work my thumb in. Try not to tear the glove. Okay, I think I'm good enough to where I can help fix a little bit. Try not to touch underneath the cuff. Okay. Gloves are on, sterile. At this point, I'm going to go ahead and soak my gauze. So I'll remove the band, pull out the gauze. And if at any point when donning my gloves, if you notice me touch something, forgive me. They are quite snug. I'm going to soak the gauze, making sure to stay in my sterile field. And then at this point, I'm going to get rid of this. This is still sterile. I'm going to go ahead and get my strip out. So I'm going to take my sterile tweezers and my scissors. I'm going to draw about the same amount that I had. About yay. Usually it takes about 2 cuts. Okay. I'm going to put this in my reservoir with my saline, so it's underneath the surface, properly saturated. Okay. Our gauze are pretty soaked now, so I'm going to go ahead and draw them. I'm going to fold in, make sure I'm only drawing one. Fold them in on themselves, corner, corner, corner. I'm going to get rid of that little bit of drainage, a little bit extra. That's got all area. Okay, I'm going to go ahead and clean the wound. In to out, circular. I'm going to go about 3 circles, and then biohazard bag. Same with number 2. Fold in the corners. Extra out. We don't want all the extra on the patient. And I'll do the same in, out, out. I'll probably go the other clockwise direction next. Make sure this last one's going to be super saturated. So I'm going to fold the corners in. Make sure I get all of that out. You don't want that on the patient. I'm going to go the other direction. 1, 2, and out 3. Okay. Now we got that sanitized. We're going to go ahead and look at our strip. I'm going to take tweezers. I'm going to pinch with my fingers through these gloves and draw all the extra out. Make sure it's dripping, dripping, dripping. We don't want it to be super saturated, but just damp. At which point, now that it's not saturated, I'm going to wrap this around. Just slightly, a little bit. I got that. So we've got a way to draw it in. And I'm going to go ahead and put that in the wound, unfurl the other way so it comes loose, and avoid touching the gauze to the patient's skin. I'm going to push it in, push it in, push it in, making sure to leave a little bit out, like that. At which point it's going to go biohazard because it was in the patient. At this point, we have effectively packed the wound, so I'm going to go and take some dry gauze, cover the patient, 3 layers, and we're becoming a little bit less sterile now that the wound is closed. So I'm going to go ahead and actually take our external dressing and place that over the patient as well. Now we're at the point where the sterile gloves can come off, so I will doff them. Finger underneath these tight gloves. Boy, unions are not for me. Okay, now that the external's on, we're going to go ahead and tape it. I'm going to assess the patient to make sure that the skin integrity around the area isn't thin or brittle or is prone to tearing the tape, and make sure they don't have any allergies to any latex or any sort of base tape. But at the, Mr. Matthias, if you're good, then I'll go ahead and use the same tape. So I will tape 3 or 4 directions across the dressing. I could do 4 just to demonstrate. 4 seems really secure and safe. Making sure it's nice and firm and down. And then I can get the top side out so it's safe. Shouldn't have to do this close. Okay, and the press on you. Alright. Looks like it's dry. It's not draining immediately, or there's any immediate bleeding. It looks like it's assessed. If you're in any pain, Mr. Matthias, let me know. I'm going to go ahead and get the tape and my pin that I had. Can't see the pin, sorry. I need my pin back. My apologies. Should have had that going in. I'm going to go ahead and tear tape. Just enough because we need to label and I don't want to write on the patient. So I'm going to put my initials, today's date, and the time, which that clock's not working and my watch is over here, so it's about 8 after, or 5 after 8. Okay, and I will put that on the dressing. After which, I will cover the patient back up. I'm going to take all this away and clean it all up. I would clean up my area. But I would go ahead and address the patient and ask, assess the site to make sure that there's not any inflammation, there's no skin breakages, no new draining, bleeding. Ask the patient if they're good and in pain, make sure it's all sterile. And clean up the site and clean up my equipment, and I would document. That concludes my wound packing video, so thank you.